As a dentist, it is sometimes quite overwhelming. That as a business owner and a dentist, I have to sometimes be a doctor, clinician treating a patient. Sometimes I need to be picking up calls, doing consults, and also I need to be the coordinator in terms of working with the other doctors on our laboratories, guiding them to how to design a certain type of case or implant or crowns or aesthetics. I just got to wear a lot of different hats. So it does get a little crazy. Having the right team was the big thing for me. A lot of the stuff that I used to do in the beginning of my career now are delegated to our staffs, and now they're better than me. I'm really fortunate to be working with them. During the day, I see patients. When I'm not seeing patients, I'm designing my cases, coordinating with the doctors, and making sure that the upcoming cases or ceramic works are going on the right track and that they're ready on time. When I have a big case or larger cases, that case just keeps ringing in my head even the day before. I just run through the procedures that I do in my head so that there's not really a lot of thinking process that happens during the procedures, but most of the thinking and the planning happens before. When I'm doing the procedures, my head is usually just blank, just executing it. Before the procedures, there's just so many noises in terms of juggling through the process. And sometimes it doesn't go the way I planned, which means I have to navigate it or change my plans as we go and make it work. The real challenge is when it comes to larger cases, especially the ones that we work as a team with other specialists, is that there's so many different types of procedures that needs to come at a certain time. Coordinating that is often a challenge, and sometimes when the implants or surgicals needs to come at a later point to wait for the patient's body to heal, the maintenance phase may be extended, sometimes 5, 6, or even 7 months as needed. And maintaining the patient throughout those healing phases in a proper temporaries that will last them and that will be fully functional for them in terms of smiling and chewing and eating can be a challenge. And my patients, they see me so many times, we become good friends. When they come in, many times they know every little bit details of our staffs, what they did during the weekend, what their families are like. We get to really build a personal relationship with them, which is another big caveat, and it's a big rewarding part of my work. It's a challenging thing to get a break. When I'm in the practice, my head is spinning, just thinking about every little bit of everything. I would say the only possible way to get a break is just step out of the practice, but that rarely happens. I've been trying to get a lunch break, which is a difficult thing in this setting, which is okay. I'm kind of used to it. So I just grab like little snacks or munches that I can just grab in between procedures. But for now, I'm handling it. I think we're having fun. But I make sure that our staffs get a proper break. What we do is there's a lot of behind the scene that goes into it. Insurance verification, making sure that the patient can get the most of the benefit that they can get, and that we, our staffs, understand how their benefits work so we can explain to them when we're explaining treatment plans or procedures that needs to be done for the patient. So the lab work that goes behind it. All of these tasks is impossible without a proper team, and our front desk team, our admin team, our clinical dental assistant, our laboratory, and all of those staffs are really good at coordinating and working together. Teamwork is everything when it comes to this. Best part of the day is when we successfully complete the case and we see that the patient is smiling and just patients telling me that their life is changed, sharing their story of how our work has brought good and smile in their life is just so rewarding. That moment, I usually bring the patients out to the front desk, show it off, gets them all excited. That's probably the best part of my day. I'm really passionate about dentistry. Problem solving itself is like a game to me. And prosthodontics is like an art that I'm really passionate about. Just doing dentistry, working through the cases with our team upstairs, with our laboratory, it's just fun. The work itself is fun to me. Having the patients, making sure they're okay, it's work. But at the end of the day, we make it work. And when it's done, it's just so rewarding.